So many people are coming together today, and if I go through the long list, Ben, I suspect there won't be much more time for questions or the presentation, but it's a tribute to you as to how many people you've been able to draw together, I think, here today, and I thank you very much for doing that. It's a pleasure to be back, of course, for the second Daily Telegraph Bush Summit, and last year we had a lot to deal with, and that hasn't changed. Drought, floods, fire, and of course there has been more, and the drought that was strangling the life out of so many communities across Australia, and while it has abated, that's true in some respects, as Shane reminds me constantly. When you go to the subsoil, when you get beneath the surface, we know that that's still a very real challenge that is being faced in rural and regional communities all around the country, as Michael also reminds me. And while you do see a bit of green, not a green, Michael, but a bit of green, about the place as you move around, and those of us like me who grew up in the suburbs, you can look at the surface and think it's all okay. It's good to know that we have the right advice that is helping us understand that these challenges continue. Here in Cooma, you also missed much of the rains of March and April. But last month and this month, well, you've got a lot more, and that's good to see. It was great to see as we came along and driving along here that things were better, but it's clearly got a long way to go. This year, Australia, like the rest of the world, is enduring the most significant downturn in our lifetime. That's the challenge now. The COVID-19 pandemic has touched everyone, anywhere in the world in some way, shape or form. And I'd like to take this opportunity to thank particularly regional Australians, as the Deputy Prime Minister was doing this year, who have felt a heavy burden during this pandemic. In a different way that people in Melbourne have been impacted, particularly at the moment, but a very heavy burden nonetheless. I know that state borders are putting enormous stress and strain on Australians, especially those in regional border communities, including by limiting access to essential health care, keeping people from their work, restricting farmers' accesses to their property and their markets. I've had hundreds of letters and emails from cross-border communities over the recent weeks and months, as have my colleagues, and they've shared those with me. And today we learn of the just unthinkable and heartbreaking case where a young family had to take their daughter, I think it was, to Sydney and sadly passed away. This is heartbreaking stuff. And I can understand people's frustration and indeed anger. This is what a few other stories that have been raised with me. Andrea is a teacher from Serviceton in Victoria. I hope I pronounced that correctly. 1.8 kilometres from the border, teaches in border town, South Australia. She was not deemed an essential worker, so a class is without their teacher. Les wrote to me about his 89-year-old dad. He lives by himself. He and his wife Linda visit every fortnight to care for him, and now they can't. And that worries them no end, understandably. Mark has a house and a cattle property on both sides of the Queensland-New South Wales border. He can't tend the animals. He says this is harder than the drought when he had to truck water every week. I've got hundreds of stories like that, and I have no doubt you have more. Real lives, all a long way from capital cities. Some restrictions, they've been so difficult to navigate. Decision-making hasn't always been clear nor timely, and that must be improved. And there has been an absence, in some cases, of due process rights of appeal as these arrangements have been put in place. Now, through the National Cabinet and what's known as the National Coordinating Mechanism, which sits in the Department of Home Affairs, there has been some progress, but I'd like to tell you there's more, because much more needs to be done to ensure that these border movements are made easier, but ultimately to ensure that we get the borders open again. I do thank premiers, particularly in New South Wales and South Australia, who have engaged with the Commonwealth Government to try and resolve many of these issues. And there has been resolution of some, and to address particular problems of particular cases, as I've been raising those and my colleagues have been raising those with premiers. I thank them for that. And we need, though, to focus on getting to a place where we don't have the borders and that they are unnecessary. Keeping Australia as open as possible while managing the twin health crises of economics and health. So the next step is we've got to get these principles established to ease the impact of these restrictions. We've got to get this done. We've got to put aside the disagreements we've had so far about this, and we've got to get arrangements that can be workable but also protect people's health. I'm not suggesting for a second that there aren't health issues here to be managed and there aren't risks on the health side of opening the borders. Of course there are. But there are risks on both sides that have to be weighted and assessed and balanced. Living with the virus until there is a vaccine requires that balanced assessment. The risk of COVID-19 does not justify anything on its own. Everything always has to be measured in the relative impacts. On borders, I've made this point consistently, that while the scale of the Victorian outbreak meant that border restrictions between New South Wales and Victoria were regrettably necessary, and they were and are and remain, this does not diminish the principle that border restrictions, especially where there are no or very low cases in regional areas, they cannot and should not be sustained. Australia was not built to have internal borders. In fact, the very point of federation was not to have them. That was the point of Australia. That was plan A for Australia. I'm for plan A. And so is Alfred Deakin, a Victorian father of federation, who said, when he was referring, in fact, to external affairs powers, which has been topical of late, the whole scope and spirit of the Constitution require that, save for the purposes of their domestic policies within their own domains, the states shall be blended and absorbed into one political entity. They may still appear, in some respects, as a body of allied states, but to the world without it, they have become and must remain a nation, a commonwealth, one and indivisible. Now, he puts it better than I do, but that is so true. We must be one and indivisible as a nation, whether we're from the bush, whether we're from the city, whether we're from Queensland, the Territory, Western Australia. We must be Australians first. And we must not allow this crisis, this pandemic, to force us to retreat into provincialism. That's not the answer. And that's why I've tasked the Commonwealth Chief Medical Officer to work with the medical expert panel to get a clear clinical definition of a hotspot. Now, this will be essential for states and territories to establish containment strategies and move away from border restrictions. Now, that work was tasked out of the last National Cabinet meeting and agreed by the National Cabinet that the medical expert panel should have such a definition. And we will have one, whether it's the Commonwealth one on loan or one agreed by the states. But there will be one. And that will be necessary, I think, for the transparency of arrangements that are put in place by states and territories. Now, clear and easily understandable hotspot definition has been used in overseas jurisdictions since the beginning of the pandemic, and they can be used in a similar way here with Australian states and territories. I was speaking only to the Danish Prime Minister this week about how they were doing it, and it's instructive. In many of the border communities, residents are simply trying to move from one COVID-free region to another COVID-free region. And so we need to get borders open based on a common set of fair, simple principles, taking into account the advice of health professionals that is conveyed transparently. That doesn't mean there can't be borders. That doesn't mean there can't be border restrictions. And it doesn't mean that border restrictions in circumstances are not necessary. This is not a binary topic. It is one that has to be considered sensibly, reasonably, and in a balanced way. It is reasonable for Australians, particularly regional Australians, to have access to medical assistance, to get to work and to access their own properties. Where permits are required, it is reasonable for Australians to expect that their applications will be dealt with quickly and that there is an appeal process. Borders cost communities and the economies they constrain. They must be proportionate, these restrictions, to the risk that presents. And like any restriction in a pandemic, they must only be there where health evidence transparently supports that position and only for as long as it is absolutely necessary. Borders are not substitutes, as New South Wales, I believe, has demonstrated, for the core defences against the virus. The international quarantine, the testing, the tracing, COVID-safe behaviours, the distancing, staying home if you're sick, getting tested, and outbreak containment, particularly at that local level. We saw a tremendous result of that in northwestern Tasmania early on in the pandemic. Local outbreak containment, very effective, protected Tasmania more broadly from what could have been a far more serious situation. Now the Freight Movement Code, which the DPM has put in place, and congratulations for doing that, Michael. He knows that there's still bugs and things. We've got to get out of that. Still a bit too many bits of paper, but Big Mac will get it sorted. I have no doubt about that. We're seeing improvements in some areas, but there need to be more. And David Littleproud is leading the agricultural ministers, Deputy Leader of the Nationals, and finalising an agricultural workers code as a priority. We agreed that last Friday that would be taken forward, and we'll be dealing with that next Friday at the National Cabinet. At the same time, we're opening borders. There needs to be a principle-based approach to easing restrictions, particularly as, say, Melbourne comes up out of level 4 and back into level 3, and hopefully in the rest of Victoria, level 3, back into more eased restrictions. The principles for easing restrictions need to be simple. They need to be transparent. They've got to be driven by data. They've got to be location-specific. They've got to be co-designed with industry where appropriate. You've got to talk to the businesses and the industries that are involved. They've got to be well communicated. They've got to be based on a demonstrated preparedness, ensuring that the appropriate risk management practices are all in place. We do not want to see a reversion take place when you're trying to come out. And so we have to do that safely. And our job, federal, state and territory governments, is to achieve this. And I know there are frustrations, but I can assure you, when we all get in the room again, we'll be working to try and sort this out. We're achieving this to save lives and livelihoods, and there are key things we need to do: a health strategy, an economic strategy, and ongoing behavioural changes, and that has all been demonstrated to be part of the plan. We are still in the midst of this battle, and so we need to keep pushing on with our response, and particularly on the fight to save jobs and build jobs and rebuild businesses and industries.